Welcome to the 2023-24 Distinguished Speakers Series. Today, businesses must continually acquire new information and turn that knowledge into strategy. To facilitate this process, Husson University, home to the largest business college in the state of Maine, is pleased to continue to present the Distinguished Business Speaker Series sponsored by MMG Insurance. This series, launched in conjunction with the opening of Husson's new College of Business building, Harold Alphont Hall, in 2021, has included dynamic speakers from a variety of disciplines, ranging from banking, government, and security to management, marketing, and more. Its main objective is to educate students, alumni, and community members on the challenges facing businesses and related professions, as well as to inspire those who will become our future leaders. Today, we welcome Mary Prybylo. Mary became the president of St. Joseph's Healthcare, St. Joseph's Hospital in Bangor, Maine, in 2011. Having worked in patient care as a registered nurse and later receiving her MSN, Mary brings an understanding and compassion for people, health, and care, along with extensive experience in both leadership and administration. Prior to her time at St. Joseph's Healthcare, Mary served as the Chief Operating Officer at Waterbury Hospital Health Center, where she was responsible for operations, physician partnerships, and strategic initiatives that supported the delivery of patient care in both inpatient and outpatient settings. Prior to this, Mary held several positions, including the Director of Community Care Management and Vice President of Managed Care and Operations within the Anthem Blue Cross and Blue Shield of Connecticut system, as well as Vice President of Patient Care Services at St. Mary's Hospital in Waterbury, Connecticut. Knowing how important healthcare is to the American economy, and the challenges that are confronting healthcare in today's society, it is our privilege to welcome Mary, and I'll now turn things over to Dean Hanson to start the conversation. Thank you.
Thank you, President Clark. Well, good afternoon.
Good afternoon.
So glad to have you, and
Yes.
This is really exciting to have a woman in leadership that has experienced such a long history of leading different types of groups, different organizations. Before we talk about that, I want to go back and say, do you remember our first job and why it might have stood out to you?
My first job that I was paid for was working in the dietary department in a nursing home. And I remember it distinctly because I was always given the assignment to make the egg salad. And to this day, the smell of hard-boiled eggs, because to make egg salad for a big facility,
Sure.
I mean, there were hundreds and hundreds of eggs. But it also gave me a good understanding of the underpinnings of an operation in terms of healthcare.
Absolutely, and working with people being a big part of that.
Yes.
So clearly you started in a place where you care for others,
Yes.
I'm guessing. And because I know enough to know that you do care, why nursing for you?
You know, I was lucky, as I've heard from others, that I always knew what I wanted to do. My mother was a nurse. I mean, I had two things. I thought about being a nun or a nurse. Okay. And I thought about a nun because I liked their outfits. They wore the long, and I thought
it's easy.
Yeah,
right?
and I thought for dancing, it would be kind of nice to dance. Nurses, you know, they had some accoutrements that they wore. Well, then I found out what nuns did, and I thought, oh, no, that's not for me. But I've always wanted to be a nurse. And I had a chart, you know, I graduated early from high school. I knew I was going to go to college, then get my master's, be a clinical specialist. Never thought I would be in management. And we were saying to the group before, I remember thinking, like, what do those managers do? You know, why don't they come down and help us, you know, while we're working here? Never had any thought about going into management.
Why do you think that is, besides not knowing what they did? Why did you not consider leadership as a young person?
Well, I think we don't value our leaders as we should. And we don't recognize that it is an art and a science. There is learning that goes with it. Not everyone has the education or the ability to be a leader. So I think at times it's devalued, especially in clinical roles. You know, I will still say today that I'm a nurse. That's how I view the world. That's the lens that I use. But you know, people will say to me, "Oh, you're not a nurse anymore. You know, you're a manager, or you're one of those in a suit."
Sounds awful, right? When
It
you have a
is.
manager.
It is,
Yeah.
you know, or they'll pick a floor, like, "Oh, you're from the 4th floor, you know, you're one of those."
Right.
You know, that's how I used to talk when I was a staff nurse. But I think as I got exposed to the roles, and I think I was exposed to the roles, I think very often because I was getting into trouble.
Oh.
So I think they thought like,
Truth
well,
comes out now,
yeah, I was suspended a few times. So, you know, maybe if we make her a supervisor, it will get her under control. So I kind of went up.
Work?
Well, no. But I did get a different appreciation. Yeah.
Well, it is interesting. There's not one form of a leader, and I think that's what we're going to talk more about today. But when you started to get that appreciation, what interested you first to stay in that clinical director role? What made it interesting?
I think because I could make a difference for patient care and for staff. I mean, you start to see that you can take those same principles, again, as a nurse, as you're looking at that patient from all the different perspectives, and then you move it up a level and you start saying, okay, how can I break down some of the barriers? How can I make a difference? You know, I think one of the first things nurses historically would be blamed for hoarding linen. Anyone who's clinical here. And we did. And I used to say, you know, I'm not hoarding it because like I want to take it home or something. I want it when I need it for my patients. So it was one of the first things when I was a supervisor that I was able to get the housekeeping and the laundry director to come up and say, how about if we add on some more deliveries of the linen on the night shift so we don't have to hide it in the ceiling and have it available. So I felt like, wow, I was able to take the voice of what the issue was and make a difference.
Well, I love the connection, advocating for the patient, but also advocating for the staff, kind of thinking about the whole organization. Well, you've stayed really in this healthcare line of work and administration through time, and we won't say administration in the quotes of bad.
Yeah.
Prior to your current job, is there another job that stands out to you because you felt like it made a difference for you?
Well, I think when I went to work for Anthem Blue Cross and Blue Shield, and again, within the healthcare field, there is issues between healthcare providers and payers. And a lot of my colleagues were like, you're going to work for the evil empire.
Right.
You know, why are you going there? And I went because I wanted to learn. And I learned that there are a lot of good people who work for the payers who are trying to make a difference. I learned that reimbursement drives our healthcare. So if you want to change and do something, you better figure out how you're going to drive the dollars to be able to do that. And as nurses, we didn't always pay attention to that. So I was able to learn that. I also learned that they speak a different language. I mean, I would be brought into meetings to say, Mary, we just had a meeting with these hospitals and we can't understand. What are they talking about? So I think that was a huge lesson for me. You know, be careful about how you judge people. You know, and Anthem is a for-profit. They made a lot of money. Their campus, I was working in an inner city hospital where we had duct tape on the carpet. And the cafeteria at Anthem was like a 4-star restaurant. I mean, it was incredible. But you have to kind of move beyond that and also then look at the people who were really trying to make a difference. And they felt those members were people that they had to protect from the hospitals that might do bad stuff to them. So it was interesting hearing the two sides. So I learned a lot in terms of financing.
Well, and the perspective, that's just so interesting to be open-minded enough to hear the different perspectives and to use the word finance. So my business mind just clicked in. Was that a hard transition to look at finance from being a nurse, from being clinical before?
Yes. You know, I think very often it's the area that nurses and maybe it's women are most insecure about. And again, very often what I find, it's a language.
Yes.
Because if you talk to people, when they run a household usually, they run a budget, they have an understanding about money. They just might not know the exact words or the terms that are being used.
Sure.
And it's understanding that. I mean, the big learning for me was working with actuarials. And if I was going to show an ROI on any kind of case management or whatever, I had to prove it through the actuarial. And that was an experience. And I learned a lot from that. But again, it was, we best understand the finances or you're not going to achieve what you need. And very often nurses would say, well, I don't want to think about money, I'm just going to think about the patient. No, you better, because first of all, the patient is spending money and you're using their resources. And again, if you want to change healthcare, then you better figure out how is that going to be paid for.
Well, I love that you said it's a different language. I also hear there's fear that
Yes.
comes with this. You did mention women perhaps having that fear as well. And certainly we could spend a whole day talking about maybe where that fear comes from, but I appreciate what you're saying about how to overcome it. They need to try it. Is
Right.
that fair to say?
Yeah.
So you've tried a lot of different leadership pieces, and I guess I want to accelerate to where you are right now. There's multiple titles, so maybe we can just kind of, I understand
sort
multiple
through the
hats,
titles,
right?
yeah.
So
Yeah.
there are different organizations connected together. Could you explain that a little bit to our audience, how that works with St. Joe's and Covenant?
Yeah, because there is a few. So St. Joe's is a part of a system called Covenant. We're different than other healthcare systems. If you look at Northern Light or Maine Health, it usually have a primary large healthcare system and then smaller feeder hospitals that come in. Covenant is a Catholic system. We're what is called a public juridic person. And it's like the only Latin that I know. But we.
I was going to say you're all set for law school.
I
based on what
know,
I just heard.
I know. It's like I'm so proud I can say it. But we are able to sponsor healthcare organizations. So there were groups of nuns who were sponsoring hospitals, the Grey Nuns from Canada, the Felician Sisters that were at St. Joe's, and there weren't new nuns that were being recruited. So they needed to pass over their mission to another organization. So Covenant was formed. We're the first public juridic person. We report to Rome. So we're set at a very high standard, because usually the only people that can sponsor a Catholic organization is a diocese, a group of nuns, or a group of priests. So we were the first lay people that did that. So we do have a matrixed organization. We have 3 acute care hospitals and then many post-acute hospitals within New England. So it is a matrix, and the system has gone through many variations. Where everybody reported up to the system and then it flipped and everybody reported down. Matrix organizations are tough.
Yes.
They can be very tough.
I'm not sure what the answer is there. What have you seen work best with the matrix?
I think when people look at kind of who their customer is and how you can offer support. You know, I've had corporate CFOs who would call and say basically, how can I help you?
Sure.
What is it that you need? Understanding that at the local level, you have the accountability and there's a lot of different dynamics going on. But then I also have to respect that those individuals are trying to help and bring something to the table and be open to sharing and having that dialogue and not be like, oh, the system wants to do this. And I must say, I mean, Covenant, the thing that has kept me there is people are very focused on the mission. And instead of, even when we have tough financial times, it isn't that we're going to get rid of our Safe Nurse program or something like that. We're going to figure out how do we become financially stable so we can continue to serve our communities, which you can get behind that.
Yes, that's meaningful. So
Yeah.
you're responsive to many different people, including out of the country at this point, as sounding.
Well, and
so.
then also I have a local board. So I report to the chairperson of our board, which is President Bob Clark. And then also I have a system CEO that I report to. And then the other organization that I helped to start was an accountable care organization. called Community Care Partnership of Maine. And that was started in conjunction with PCHC and Ken Schmidt. And we started it about 7 years ago. I was CEO of that until this year, and Sandy Nesson took over. But we have 22 organizations across the state, and we serve about a quarter of the population in the state. And an accountable care organization is a reimbursement model by the federal government and also by other payers, where you're given a fixed amount to take care of someone every month. The reason I love it is because in order to be financially viable, you've got to keep people healthy.
That's right.
Whereas traditionally, hospitals are run on a fee-for-service. The more procedures somebody does, the more times they come in the hospital, the more we get paid. As a nurse, I think we need to be thinking about how to keep them out of the hospital. So this model of reimbursement, again, reimbursement, drives the design of our healthcare, really makes a difference. So very proud of that organization and what we've been able to do for rural communities and others.
Well, and that's a great connection back to your experience at Anthem. So you certainly saw what it looked like to have that payer model and what influenced, and I love how it's influencing you today. So we never know where our jobs might take us and what they might drive.
Yeah, so true.
With all of the people you were reporting to, I think sometimes people think, oh, the CEO, she's at the top. She doesn't have to report to anyone.
or they think like, well, she can tell people what to do and get things done. I mean, I've had physicians come and go, like, why don't you just tell them what to do? And it's like, unless I watch them 24/7, it's not going to happen. You really, I might have some authority, but it really isn't. You've got to influence and get people's hearts and minds. Otherwise, they'll find ways to get around if they don't agree with what you're saying. Yeah.
So how do you do that? How do you influence?
Well, I think it's listening to people. I think it's respecting people.
Sure.
In nursing, we talk about shared governance, but I think it applies to everyone. Everyone wants some autonomy. Everybody wants to have some say over their practice.
This is mine.
Yeah.
Like, I want to control this. Yes.
Yeah, or have some input. So even if you're EVS or housekeeping, we should be asking them, gee, what kind of supplies would you like to use? What would be, and treat people as adults and with respect. I think it's important to be present when times are bad, be as honest with people and get back to them. My priorities and my role is certainly if there's any patient issues or staff issues.
Sure.
I mean, that's the only reason I'm there, is to help break those barriers down. So you have to build some trust that you're actually going to do something, or at least get back to people and tell them why you're not.
And trust is such an important word, I think. Very, from my perspective, easy to lose.
Very easy to lose.
And have you seen that in your experience as a leader, that things not going in the right way?
Yeah. Again, there's sometimes things that you have to do either with, I find layoffs are probably the most difficult thing I have to do in my career. When I have to fire someone, I feel that that's a dual thing, because I hopefully am saying that you're not a good fit and have given some feedback, but layoffs are so difficult because very often it's a surprise to people. They're good people. I've learned the most you can do is be as respectful as you can and make, so they can save face. But you lose trust in the organization.
Sure.
People are like, what was that about? And why are you keeping that one? But you got rid of that one, and he's been here for 40 years. And so that is difficult when you have to make some of those decisions. And you do the best that you can with the information that you have.
Yes. You're human.
I am human, yes, and I have made mistakes.
And I feel like that is also a good reflection to say, okay, I'm trying to do the best that I can. Thinking back, now it's hopefully a little bit in our rearview mirror, but not completely. During COVID, how did the whole organization shift from your perspective? I know you don't want to relive it, but maybe just for a moment.
Well, and I was thinking about that, and where I worked in Connecticut, we were near Manhattan, and when 9/11 occurred, and I was the COO on, and we got the call. You all remember, we didn't know what was going on, but as a hospital near Manhattan, we were told to be on alert to to get victims. And then you were getting calls like, anthrax. I'm like, anthrax? And we were looking it up, like, what do we do? And then people wanted to leave because we were all so scared.
Of course.
And they wanted to bring their children, their dogs, and everything into the hospital. So, I learned there, because I was scared. I had a brother who was up in a plane. I didn't know where he was.
Oh, my goodness.
And I learned that you have to be present. You have to stand up. You have to be honest with people. You have to tell them what you do or you don't know. So I think when COVID hit, never did I think that we would experience. One way that this city shifted is as a community we pulled together. We had the Community Health Leadership Board. So pulling together saying, okay, what are we going to do about the homeless? What are we going to do about post-acute facilities?
Sure.
And then in our organization, it was a constant hustle, a constant, I remember just going to sleep dreaming about, where am I going to find face shields? Where am I going to get masks? I mean, we were going to the Challenger Center, to UMaine. I had a physician come to me and say, the N95s that you wear, where in our past lives, you'd only wear those for like one encounter, or surgical mask. You'd never wear those like all day or whatever. And he was saying, I think we need to get a garbage container and save the N95s and recycle them. And I was just like, what are you talking about? And of course, we came up with a way to be able to re-sterilize them. So we shifted by being incredibly innovative, but also, I think, again, being present, honoring where people were at and the fear that they had.
Sure.
I'll never forget going down and meet with the housekeepers, the EVS, with the infection prevention person. And this was early on when we're all still so scared. And we're going through what they're going to have to do to clean down a room where a COVID patient has been.
Right.
And they were looking at us like, you got to be kidding us, that this is what we're going to do. And then, what happens if I get it? And what about if I go home? And the fear that people had. I have such respect for the staff, but also for the managers. I mean, the true heroes were those managers on the front line who had to maintain, an esprit de corps when people were kind of falling apart. I think where it also got really difficult was during that time when suddenly we had the vaccine, we were all hoping for it.
Right.
But then people were like, no, I don't want the vaccine. I don't believe in COVID. I mean, we had staff who, let's say in ICU, who, families would always be, oh, thank you so much. Where now families were yelling at them. What do you mean? They don't have COVID. I'm not wearing a mask. I'm not coming in here. And the abuse back on the staff. And to see 30 and 40-year-olds dying because they didn't want to get the vaccine. And the next lesson for me was around, in our state, it was mandatory for healthcare providers to have the vaccine. And when that came down and staff were going to have to be fired, terminated, and meeting with staff about that and how angry some people were. And really, sitting there and listening to clinicians who said, I don't believe in the vaccine or God is telling me not to get it. And having to keep my civility
Sure.
and really say, this must mean a lot to you. And I respect that it does. I mean, we had staff nurses who had long careers who quit. They would not get a vaccine. And so I had to really step back and say, I will respect that this is really important to you. But I can't change. I'm not going to go lobby to change this or anything else. But I respect where you're at. And that was really hard.
You almost
really
had to
hard.
keep your own personal peace quiet one way or the other, but still be present. That's a lot of things to balance.
Yeah, a lot of staff meetings where people were not too happy,
And I think that can happen with any heated subject, but this is certainly one that most everyone in this room can relate to. And how, when you went home at night, how did you rationalize everything that was going on from that emotional side? What did you do for yourself?
Yeah, because, sometimes it was hard. I can remember some weekends, going into work where we were just flat out and, the incidence was going up higher. And I would go by some house where they were having a picnic and everybody was gathering. And you just want to go, do you people not know, like this altered reality, like,
Right.
do I like not live in the same, do you want to come into the hospital and see what we're dealing with? Or, you know, I think in some ways, it was good that I was so exposed and knowledgeable. So I certainly wasn't staying at home or having some of those issues. I have a very supportive family. And I think it was just taking time and trying to step away because it was exhausting. And it
Yeah.
was 24/7 and the worry of,
Sure.
again, just the supplies. I mean, to this day, I'm like, stockpile those supplies. I never want to be without.
And hopefully you'll never use them. And
Well,
then,
no, I
you
believe
know.
it will come again.
Yeah, and
Yeah.
it's just interesting to me with as leaders that we're taking on potentially everybody else's emotion around us. And I do see that as a fear of why not to be a leader. Well, everybody's going to yell at me.
Yeah.
What do you say to a student that may be worried in the future? I don't want to be a leader. I don't want to have people yelling and screaming at me. What do you do in those instances?
I say take a lot of courses in psychiatry. Because sometimes I feel like I'm a psychologist. Yeah, it was funny. I was talking to a young medical director who's a new leader. He's only been out of really residency a few years. And again, those middle managers are in the worst spot. You know, because I was saying to him, yeah, you can't go out with your friends and go to the bar and have a drink anymore. You know, you don't have like a little tribe. And then you have these people from up above who are telling you everything to do, and everything is your fault that you didn't get it done.
Right.
And he was like, yeah, I'm just overwhelmed. You know, so I think it's building a mentorship so you can meet with other directors. So we try and establish that. You know, we use coaching so that people have an avenue where they can go and talk about how hard this is. How do I respond? Because you are dealing with individuals
Right.
who are carrying all kinds of issues from their own lives. So it is very complex sometimes when you're trying to work out the workforce issues that are occurring. But I think giving people an opportunity to learn and get that support, maybe learn some tools as to how do you intervene, but also say, you know what, it's going to take a while. You're new at this, it's all right.
And you can make mistakes. Those
Yes.
mistakes are learned options anyway. We say it's in a safe environment here, but certainly in the workforce, it feels different.
Yeah, yeah.
Well, shifting gears a little bit, but not that much from the leadership side, I want to recognize you as a female in this role, and you've ascended into the CEO piece, and we certainly think about just finishing Women's History Month, what women have done. What are some of the things when you look back as you as a female in leadership that were tough? Maybe because you were a female, maybe because of something else. What do you think came across?
Well, you know, first of all, I'm in a profession of nursing, which majority are females. And we also have the issue, I mean, hospitals are like academic centers. They're incredibly complex with, you know, you got physicians and I mean, you got people with all different licenses and, you know, and you're dealing with people's lives, you know, where you can harm people. So, you know, as a female nurse, you have the issues with physicians who the majority were men. So, you know, there was a time, not too much, but, you know, as a nurse working on a floor where a physician would come on the floor and say, get up out of that chair. I need to sit down. Or I want that record. Or don't speak to me about that. And you know, you think, well, yeah, it was a long time ago. Well, no, there are still some of those pieces there. As I moved up into the senior leadership, you know, I was the only female very often because I was the VP over patient care, you know, as a nurse. And also, I was younger. My husband and I both worked. And the men that I worked with had wives who were at home who were managing their homes and their children.
Sure.
And, you know, I remember having to hide the fact that I had to get out on time because the daycare was going to kick me out if I was late one more time. But you couldn't say that.
Right.
You know, and I think what I learned is I want to create a different environment where men and women don't have to feel that way. Where if you want to go to your soccer game or do something else, you know, I find that if you give people that flexibility and you respect them, they'll give you 150%. Now, a staff nurse, you can't always do that, but you know, even for that, make arrangements if it's
Sure.
a significant event or something like that. But those were challenges. And I learned also that, one, you deserve to be at the table. And, you know, we were talking earlier with a group about that whole imposter syndrome. And I've heard men have a similar feeling, but that kind of thing, like, when are they going to find out, like, I don't know what the heck I'm doing? And, you know, or even that feeling of, you know, when you see, let's say it's a VP position, and traditionally, if a woman was going to go apply for that, they'd say, well, I don't have all the experience. Maybe I better get 2 or 3 more degrees.
Right.
Whereas if a man looks at that, they'd say, I'm going to go in that position. I'm going to learn while I'm on the job, and I'm going to do well. So I think, you know, learning that, you know what, you have to have confidence. You know, the other piece that we were talking about, and I learned this from my son, was around talking about your salary. And I'm sure it's probably hard for everybody, but I find with women in particular, I think it's a little difficult to be saying, hey, could we talk about my salary? Have we done an evaluation on when you're going to be hired? And I was talking to my son one day who's in college, and I said that I had come across that there was a male and female in similar roles, and the male was making more money than the woman was. And I was really upset about that. And I said, you know, that should not have occurred. There should have been a standard where someone in HR or somebody should have been looking to see that this didn't happen or whatever. And my son said to me, well, the man probably asked for more money. And I was like, but that's not right. You know, you can't just do that, you know. But as I thought about it, I thought, well, you know, that's probably what happened. And why didn't the woman say, yeah, you know, what could I get for an increased salary here? So it was a lesson to me to say, you know, be careful that we don't fall into some of these biases that might be there and step up to the table and say, yeah, I deserve to be at this table. And by the way, you know, when will I get an increase, or when will, you know, things happen? I still yelled at him and said, you know, don't you ever let that happen if you're ever a manager. But it was a lesson to kind of
probably
learn.
for him too at that point.
Oh yeah, he kind of knows. Oh, don't talk to Ma about this one.
But it is, I appreciate you brought up imposter syndrome, particularly for females, but it is across the board with all of us feeling like we're not deserving, or what is our worth, and questioning how we see that in the workplace. And you talked a little bit about providing flexibility in the workplace. What else are you doing to make sure people know they matter?
Well, you know, I think it's as basic as we learn of thanking people. I think, you know, David Brooks has a new book out about listening and being an illuminator. You know, the fact that you're asking me my story is an incredible privilege. You know, that makes me feel like, whoa, boy, maybe I got some worth, you know?
Yes.
And I think just anyone.
You do, by the way. Thank you.
Oh, that imposter, sorry, that imposter syndrome. But I think, you know, talking to anyone and saying, you know, what brought you here? Why are you interested? Or asking people, what are your goals? What would you like to do? What are you interested in? We do career interviews with staff where we ask them, the big question I always ask is, when was the last time you thought about leaving? Which always gives me angina, because sometimes they say, like, yesterday. I'm like, oh no.
Well,
but
they're being honest.
Yes. So maybe you have an opportunity.
Right.
But it's also asking, what brings you joy? You know, what gets you up in the morning? And how can we give you more of that? Because there's always going to be stuff that's a real pain, but how could we bring you more? So I think just listening and talking to people shows a level of respect.
I love that. One of the most recent articles I was reading about organizational awareness, our #1 tool is listening. And sometimes when we're listening, we're thinking about what we're going to say next, so we're not really listening.
Right.
I just heard what stood out to me, what brings you joy. What brings you joy?
Oh, what brings me joy? I think fertilizing people and seeing them bloom. You know, whether that's a patient, you know, with developing a system, you know, like CCPM or what we've done in the community, And it's what I'm sure faculty feel like, or parents. You know, when you see that person and you kind of just give them a little fertilizer,
Yes.
and then they come back and they own it. You know, where it might have been that you said this, but they're coming back, do you know that this is, and you're like, oh, it's so good. You know, Sandy Nesson, who is here today,
Yeah.
you know, to see the growth that she's had.
Sure. Yeah.
So I think that brings me joy. And, you know, trying to make a difference. Our healthcare system is so broken. And I mean, there's a lot of good things, but there's a lot of broken things. And so I keep thinking, like, I'm not going to get overwhelmed about it. I'm going to try and just make a difference, like, right here. And if I can do that.
Well, I won't ask you how to fix all of it.
Yeah, good.
Because that could be a long conversation. But for the students that are starting on career paths, what's the advice when they're getting ready to look for a job? Because you were just talking about these interviews, maybe stay interviews or
Yeah.
career interviews. What should they be doing to get themselves ready?
Well, I think one, you should always research the organization and, you know, find out what they're about, what their needs are. It'll help you to promote yourself when you're kind of advocating for a salary or something of that sort, and be clear about and confident about what you bring to the table and the difference you can make in the organization. And you've got to be able to summarize that, you know, that elevator speech that they always teach you, you know,
Yes.
when they ask you, like, oh, could you tell us a little bit about yourself? Like, you better get that down in a minute or two. But also be clear about what I could bring. And even if you're new, fresh out of school, you're bringing something to the table. And, you know, it's that intrinsic piece. It's that you've been in school, you've worked with teams. You know, and the other thing I was saying is always look for the opportunity. Say yes, you never know where it's going to happen. It'll keep you more resilient. And so if there are layoffs or something that happens, I always say to people, you know, keep your resume and your network up. But also be saying yes. If somebody says, hey, you want to learn this new software? Say, yeah, okay, you know, I'll learn that. Or do you want to manage this department? Oh, yeah, all right, you know, I'll give it a try. Say yes. And I guess lastly, I'd say continue to learn. I know we hear this all the time, but you know, one of the things I ask in interviews is, what was the last thing that you read? I don't care if you read a fiction book. I don't care if it's an audio or whatever. And there are actually people who say, I can't remember anything. And it's like, a journal? Have you read, you know, something? No. Because even fiction, if you're reading it, you're walking in people's shoes. You're learning about lives that are different. It does help you learn. And be continuously learning and trying to take that information and then synthesize it and see how it applies in your workplace. People stand out who are able to be continuous learners.
I can't stop, so I know that there's people in the audience that would tell you that. But what are you doing to enhance your learning right now?
Oh, jeez. I'm going on. I mean, this is a whole thing on talking about feeling like an imposter.
We can have a therapy session if you want.
Yeah. I'm going on for my PhD in nursing. And, you know, it's at a later time in my life. And I was saying to people earlier, it's a humbling experience. And when I was accepted into the program, they had said, well, you know, when was the last time that you took statistics? And I was like, well, you know, in graduate school, it had to be within 5 years. So they said, oh no, it'll be a requirement of acceptance that you have to take another statistics. I did not like statistics, I'll just tell you. I took it undergrad, I took it undergrad, I took it graduate. So then I call up Husson and I say, gee, could I get a statistics course? And they said, well, when was the last time you took algebra? I said, algebra? I mean, you can see how old I am. I'm like, high school. I took it in high school. So, you know, I was telling them that there's a math exam then that you have to take to see where you're going to be placed, if you could be placed in the statistics. So my son, again, who, you know, he goes, Ma, Khan Academy, you know, get on and cram. I had a weekend. And so I'm trying to cram, you know, listening to Khan Academy. Well, I failed. So I had to take algebra. And now I'm in an algebra class with STEM high school students here at a college level. I had an incredible, and it was online. I mean, I work with a computer. My son is in computer science. He thinks I'm an idiot. But I also work with an executive assistant who runs my life and manages. So if I need an Excel spreadsheet, I mean, it produces. Well, now I've got to manage this program. I have not been an online learner. You know, I finished my master's in '83. That wasn't even a thing. So it was incredibly humbling.
I bet.
But also, I found that, you know, I had to reach out to the professor. I was in the help sessions like constantly. And then I had to take, after I finished algebra, I had to take statistics still. Luckily, I passed. And then I had to take it 2 more times in my PhD.
Yeah, it's hurting me. I'm a qualitative researcher. I get it. There's some in the back there that are like looking at me going,
yeah,
oh.
I mean, I became best friends with the TA. But, you know, I think it has taught me to be humble. It is that imposter syndrome. And what the faculty say to me is, well, you know, you're a student. You're not expected to know everything.
Right.
But I also find, compared to you know, I'm the oldest student in my cohort, but for the younger students, they get very worried about things, and it's kind of like, I have a different perspective. It's like,
Sure.
we're going to get through this. You know, it'll be okay.
Right.
That we call it the sea of red when you get the papers back and they're just covered in red. It's like we text each other. I got the sea of red today. Woohoo! Good.
Badge of honor for that.
Badge of honor.
Right?
Yeah. No, but I think one, I'm trying to, I mean, I'm doing it for myself.
Yeah.
And also I want to do more research in nursing and improve patient care, but also for my children and others to say there is no time that you can't go on. And whatever the learning, it might not be a PhD that you want to do. You might want to go learn to be a beekeeper or whatever it might be.
Well, congratulations on taking the plunge.
Yeah, taking the plunge.
I think that's
I'm not done yet.
Yeah, I think
I'm gonna.
But that, in some ways, is harder than
Yes.
the completion. And I think that's the important piece when we think about what we do in life. Sometimes it's just that first step, and that's where the imposter syndrome comes into play. Like, I'm not good enough, I can't do it. You start to talk yourself out of it. So you didn't let yourself be talked out of it.
Though I didn't tell a lot of people that I had started, because I thought, I'm not sure I'm going to be able to do this.
Did you have a support system, though, to get you started with it?
Well, again, my family, my
Okay.
husband, my brothers, my kids, you know, and some other colleagues who were definitely saying, yeah, you know, what the heck? What do you got to lose?
Right.
And again, it's a mindset. I mean, you can either
Yes.
think of yourself as, well, I'm old and, you know, what the heck? Or say, well, you know, I'm going to try it. Why not?
Why not? Yeah.
Yeah.
I think that's probably a really important piece is we have students try things in class. Why not? Just try it.
Yeah.
And then, oh, you might actually like it. Or you might not.
Right. You might not.
And that may be the lesson.
Yes.
You're still going at this, and so clearly still liking it enough to move further. So that's really exciting.
Yes. Yes.
Beyond that success of plunging, what's a success that stands out to you in your career as being something you're proud of?
Well, you know, that was one, I think, again, here in this community, I'm proud of that Community Care Partnership of Maine. You know, it is, I feel that part of my role, and this is also within this city, is as a convener to say, how do we get people together around the table to solve some of these really difficult problems? And we've had some incredible success. You know, I look at that, I look at the Community Health Leadership Board, looking at substance use disorder, which is a huge issue in our community. And we've made inroads. We still haven't solved the problem. We still have a lot of people dying, but people can get treatment now immediately in the emergency department. Whereas a few years ago, I remember meeting with parents who had children with the disease, and you know, you might have someone who overdosed and they want to get into treatment. It would be 5-6 months before, and you'd be handing them a piece of paper like, oh, here's some numbers to call.
Right.
Whereas now you can get treatment immediately in the ED if you need. So proud that the community has moved together with that, and I think I've been able to help facilitate that. Our Safe Nurse program, really, which is sexual assault forensic examiners, nurses who work with people with domestic violence, abuse, human trafficking, which is a huge issue in our
Right.
community.
I'm not sure that everybody realizes that as being a big issue, but that is
Yeah.
an important educational piece too that you're doing.
And especially for young people in university settings.
Right.
There have been some young people who have come forward as spokespersons for it, who were in university settings, who were having trouble maybe paying their tuition. Someone befriended them. And there's one woman who particularly who talks about it and was drugged and then basically blackmailed and was afraid to tell her parents or her school because they had videotaped what had happened. And I remember, again, I worked in an inner city. I mean, we had all kinds of different issues than what we have up here. I didn't really understand human trafficking. I thought, is it the restaurants? What are we talking about here? But it is a huge issue. I mean, we supported a safe house for victims. And part of the reason they say it's so prevalent is because of the amount of domestic violence, and particularly women, not that men aren't trafficked or abused too, but it's almost like it's a part of the family. So, women might be just like, well, this is what I have to expect. So then when you look at the substance use, people who have had that kind of trauma, very often they're using substances to kind of deal with that pain.
Right, that self-medication is
right.
a huge outlet for people.
Yeah. So, listen to your friends and colleagues. Again, we see it quite a bit in high schools, university. So it's not just, someone from the city or
right,
whatever.
yeah.
And certainly at St. Joe's, we have an extensive program that's regional where these nurses work with those individuals and hook them up with support and that sort. So I think dealing with some of those vulnerable issues, and sometimes people say, Mary, you're such a Debbie Downer. My gosh, human trafficking and drugs and this and that.
Right.
But we need to put some of those issues out on the table and talk about them a little bit.
Well, so I know we've talked about imposter syndrome, so by me asking you about failure, I'm not wanting to take you there per se, but I think about failure as our first attempt in learning. When you fail, that's your first time. Is there a failure?
So when I flunked that stats
That's
thing,
different.
which I did.
Those are different letters.
So it was only a 71, but they have a high cutoff for it.
boy.
Yeah, but I did pass. But
So so the second attempt, you sailed. So we give you credit for that, for
Yeah.
sure. But is there a failure that sticks out to you in your career that you've learned from?
One that comes to mind that felt like an incredible failure at the time is I was fired from one of my VP jobs. And, when you get higher up in leadership roles, it is something that happens. And I always say you need to be prepared for that.
Right.
I wasn't particularly prepared. And it's not quite set as a layoff. It's one of those, they're going to be spending more time with their family. They're not here right now. So that's what happened to me. I got called into the office and, politically, I might not have done anything different. I had taken a stand on some of the layoffs or actions that we needed to take, and there was a new COO that I was reporting to. But it was a learning. And it's kind of that thing, I'm happy it happened to me because it's the thing that you fear very often all the time, like, oh my gosh, what am I going to do if I get laid off,
Right.
And what I found out is I survived. It was okay. And I was pregnant at the time. So I was going to job interviews, and I'm tall, so I can hide a lot. But, you take your coat off and people are like, oh, geez, I don't think we're going to be hiring you. And of course, they would never say that. But I survived. I moved on to other roles. And I think what I learned is, one, you can't sell your soul. You need to decide where's the line in the sand. There's a lot of politics that you have to deal with when you're in organizations. There's a lot of things you kind of have to let go. I've learned that you always ask for a severance and make sure you get one. And make sure that you build in some of that security. Because again, in upper levels, you don't have the protection that you might have with traditional layoff policies. I learned that you gotta build your network. And also they offered an outplacement service.
Okay.
And I thought, oh, yeah, what am I gonna do that for? It was very helpful. Take anything that's offered when that happens. But again, I think the biggest piece was, reflecting back, letting go of the anger, thinking about what could I do differently,
Sure.
and also being prepared so that if that happened again, it's okay. I'll be okay. And the old thing about keep 6 months of savings and all that
Right.
kind of stuff, so you're not
Right.
financially out there on a limb. But that was hard. That was hard.
Yeah, so it made you pivot.
Yes.
And when you re-entered working, did that mean a different type of position for you?
Yes, it did. Yes, it did. It was when I went to Anthem at that
Okay.
time and had an opportunity to start a case management business off, and then I joined into Anthem.
Ah, so interesting. But
Yeah.
if you hadn't had that experience, it wouldn't
Right.
affect you today.
Right.
It's all part of that story. I'm going to pivot for a moment. Are there any questions in the audience? We have a mic that Steve will come see you. Somebody want to ask a question?
Oh, I thought he had a question. He's like,
Yeah.
raise it. Come on, you don't have a question? Yeah.
Anyone brave soul? Oh,
Wheaton.
right down here, President Clark.
Oh, he's going to get me.
I didn't know it was going to be a test. I'm sorry.
Might you share a word about your engagement with the community in terms of the role that you play? I mean, you talked a little bit about some of the organizations, but how important that is in terms of your service, if you will,
Yeah.
to healthcare.
I think as a community hospital, and also, we're a Catholic hospital, but I think it's true of community hospitals. I always say you need to sit out on your doorstep and look at what the needs of the community are. And yes, we have an acute care hospital, primary care is pivotal, but we have a lot of issues in our community that I was talking about before. So I think it's critical that St. Joe's either be at the table bringing people together around issues of vulnerable problems in the community, or leading to solve it in some way. So I see my role very much as a convener. The Community Health Leadership Board is made up of CEOs from Acadia, Eastern Maine, the city manager. And to get a bunch of CEOs together, that is a task in itself, because we are all pretty driven. We are short on our time, and what do you want me to get done? We all have our opinion about. So, but I felt it was my role, and we were having a conversation the other day about some of the huge issues in our community, even if you get into housing, food scarcity, whatever. And one of the members said, those rocks are so big, and I don't have the bandwidth. I'm so, busy at my own organization. And what we said is, if not us, who? Who is going to pull resources together? Resources are tight. We have a lot of little pockets where people are trying to do something. And, we were saying, oh yeah, we're trying to do, one of the members was saying we were doing an intervention in obesity, let's say, or something like that. But I feel like it's not making a difference. And it's like, yeah, you're spitting in the wind. But if we all joined together and did something, then maybe we could have, more of an impact. And this community is one that actually does pull together, because people live in this community. Right. Whereas when I was working with an inner city, very often there isn't a group of people who live in the inner city. What you're left with is poor people who, aren't able sometimes to join together to make change. So this community is really unique. The other thing I think is that we serve a region. And I am very worried about rural health care. I mean, the morbidity and mortality for people who live in rural health areas, rural communities is much worse. They don't have the access to primary care or to specialists. They don't have the support services. We have nursing homes that are closing throughout our state. They don't have home care. So I feel that St. Joe's role is to really say, okay, how can we help those organizations be successful? So during COVID, they didn't have the, the FQHCs, they didn't have the resources that we did to do training or get supplies. So we had to figure out how to do that. We have in Jackman, which is it's like a territory. I don't think it's even like a town or something. That was new to me too, coming from an inner city. But they had one clinic and it wasn't going to be able to stay open.
Right.
PCHC wasn't going to be able to support it. So we were able to set up a project, Jonathan Busco, who works with us, where we use paramedicine that run the clinic, and then they're hooked back to our ED. So at least you can get somebody stabilized, they can talk to somebody, because otherwise those people have nothing.
And it's
So-
hard to imagine
It is.
nothing when we're perhaps just down the street.
Right. But even in our community, it is, difficult. You need to see a dermatologist or something of that sort. Again, compared to Connecticut, like dermatology, there was a dermatologist on every corner. Here,
Right. It might be a year.
might be a year. Yes, it could be a little while. Yeah.
Yes.
So I think that community piece, and that's where hospitals need to change. Because we also need to change to say we got to keep people out of the hospital. We got to figure out how to make them healthy. But we are also the place of last resort.
Right.
So in a broken healthcare system, and you saw it with COVID, there is no other place for people to go. So if we have a power outage and you need warming centers, if the homeless, didn't, what are we going to do with people who have COVID? We run with we had a patient who was with us for 3 years because there was no place for them to go. And I cannot discharge someone without a safe plan. So when you look at the people who have behavioral health or the substance use disorder or the homeless, they come into our organization, nobody wants to take them. If you have any sort of behavioral health issue, you can't just put them out, on the street, though some choose to go that route. So we are the place of last resort, and we can turn no one away.
That's such a moving piece in listening when we look at jails, we look at other places
Yes.
that do have to turn people out. They may be coming to you as a result,
Yeah.
which makes you not only a healthcare organization, a business, a community organization, and perhaps the home to some that
Yes.
don't have something else.
Yeah,
It's a lot of
absolutely.
responsibility.
A lot of good people working on it, though.
Absolutely. Well, just as in a parting sense, what might you say to our future leaders that are in the room? Because I see a lot of them.
I know, I met some of them.
Yes.
I was like, oh, I'd hire these people.
Yes.
Like right away. I think the other thing in looking for a job is connect with a place that you think you can grow. Certainly you want a salary that you can, sustain yourself on. But salary isn't everything, and title isn't everything. And it's hard when you're young because you're trying to build that resume. But look for a place where you can have a sense of purpose. Daniel Pink goes with the intrinsically driven people. You want a sense of purpose. You want to do something that's bigger than yourself. That's what gets you up every day. That's what, on those bad days, and it's wicked hard work in a lot of our jobs. But, I'm going to make a difference today. Whether it's I'm going to go plow the streets so people can get to where they're going, and I'm going to make a difference. So I'd have trouble working for a for-profit that was just totally about profit, unless I could really see what the purpose is. Look for a place that has mastery. You want to be able to continue to learn. You want that opportunity, no matter what it is. Again, if you're the person who's plowing, you want to be able to learn about new trucks or whatever it might be. And you want a sense of autonomy. You want a leader who's going to give you, some opportunity for growth, an opportunity to make a mistake, an opportunity to be supported. I have trouble working for people who really micromanage. That's usually when I get in trouble, and it's like, Mary, it's time for you to go. Yep, I think it is. And I think that's the other part. There'll be those times where it's not the right fit, or someone will say to you, you know what, you need to go. Keep your inner core. Because there'll be a lot of people along the road that will be telling you, you didn't do this right, or you're bad, or you stink, or whatever. Get that circle of people who you really trust, who, when they say to you, you're not going right, you're going to listen to them. And keep an inner core to say, you know what, I have something to worth. There was one of the women that was in the meeting, and we were talking about the imposter syndrome, and she said, she was a pharmacy student, she said she had it a lot, but she got over it. So I said, gee, how'd you get over it? And she said, I learned that maybe I'm not too good in math or something else, and not that that's not important for pharmacists, but I'm good in some other things. And I'm bringing something else to the table. And I can work with my colleagues. Yeah, you're good at math, well, I'm good at this, so why don't we work together? So it's helped me realize, like, I bring something too.
Absolutely. Well, I think they can certainly highlight their strengths that will bring up any of those things that they're worried about. Thank you so much for sharing your story.
Thank you for asking me to come.
Absolutely.
Like I said, it's a real privilege.
And the drive that you bring, the excitement that you bring is just really contagious. So thank you for that as well. Appreciate you
you're
sharing
welcome.
it.
Yeah.
Have a good day.
Thank you.